Okay. Hello there. How's your day been? I hope it has been as pleasant as mine is shaping up to be. Thank you so much for joining us on Living LTV Live today. My name is Gbenga Adebayo, and today we're doing Ask Me Anything. So you can ask any question, and we'll be happy to answer them. I enjoy Ask AMAs because it gives an opportunity for different people, for us not just to focus on one topic, but to have a breadth and depth, maybe not so much depth, but breadth of a lot of topics that we can cover. So if this is the very first time of joining us, thank you so much for joining. My name is Gbenga Adebayo, and the program is Living Health TV Live. As we do, please, if you have not subscribed to this channel, please go right ahead and subscribe right now and share this with your friend and your loved ones. Please go ahead and do that. And I'm going to just let people know that we are live. I'm going to share this with my friends. Right. Okay. Uh, and I just don't know we are live. Okay. Right. And that is that we are live. So we are going to be asking questions. We have a bank of questions that we're going to be going through. And if you are joining us live, you'd like to ask a question, please, that's what the comment box is for. Please go right ahead at any time during the course of the program to share your question. And if you are catching this, you didn't catch us live, and you still have something, or we said something, or something has come up that you'd like to clarify, please still put it in the comment uh, of the video. We'll get right to answering them as soon as we can. So let's go ahead and start to answer the questions that we have. Right. Well, first question, please, my colleague. First question, please. First question. Do we have questions? Do you have questions? Okay, while we are waiting for the questions to come up, I'd just like to. I was somewhere yesterday to train and to teach, and we were discussing constipation. I think it's really important that because I've written an article for some people on constipation, and then it also came up there, and I think we can start to by discussing that. And I think we have one area we have some area with this. We've done some shoot area doctor shoot on constipation, so you can prevent constipation. Work hard to prevent constipation, and the things that are important as we strive to prevent constipation. Number one, diet. Right, you need to add fruit and fiber. Right, fiber, generally fiber to your diet. If you don't have fiber in your diet, you'll be cutting constipation. Take enough fluid, stay hydrated, and of course stay mobile. Move, right? Immobility, sedentary lifestyle is a risk factor for constipation. And don't ignore the urge to use the toilet, if you ignore the urge, as you ignore the urge to use the toilet, you are at risk of constipation. Okay, so we have our first question there. What are the recommended vaccinations for young adults and middle-aged people? Okay, beautiful question. First, I think the important thing to say is that vaccines save lives, right? There's a lot of myths and falsehood and misinformation about the usefulness of vaccines, confusing the drive for pharmaceutical capitalism, so to speak, with the usefulness, the public health utility of vaccines. If you can remember where we're coming from, if you can understand where the world is coming from as far as infectious diseases are concerned, you will recognize how important vaccines are in promoting health and well-being. So, having said that, so the vaccines that are important, that may be important, because the importance of vaccines are region specific, are country specific. Some vaccines are important because diseases are different for different parts of the world. So we don't expect, but there are some cross-cutting issues and diseases that vaccines will help you with. So what vaccines are recommended? I think first one that we need to talk about is COVID vaccine, right? It's important, and of course, in this age and time, as you want to travel, if you want to travel, although um, the scourge, thankfully, is I think we can safely say is somewhat behind us now. The COVID pandemic, um, like I was saying, where I was going to train recently, we are still worried. We are still worried about the next pandemic. So right now, the COVID vaccine is still available. Thankfully, we are not having flare-ups. We are not having mutations of the organism. So, COVID vaccine. And then globally, depending on when you say young adults, HPV, the Epis virus, right? Human papilloma virus, sorry, the human papilloma virus. I guess no Epis. The human papilloma virus vaccine, which is closely linked to cervical cancer, is advisable for young adults, right, 11 to 19, before they become sexually active. Is useful, protective, because cervical cancer just seems to be, it's a curable cancer. It looks like an infectious disease. For the vast majority of people that come down with cervical cancer, the HPV virus, the human papilloma virus, right, is has been implicated, and this can be prevented with a vaccine, right? So that vaccine is important. For our friends in the Western world, we don't know how much. I guess we'll still be having flu here, but we don't have a flu vaccine program. But for people in the Western world, the seasonal flu vaccine is really important for people, maybe not in the middle age, but even middle age, elderly people, especially elderly people and people in the extreme of ages. Um, they are susceptible to flu, the seasonal flu. In our own environment, in the meningitis belt, the meningococcal vaccine, right, is really important for young people. Although what we do here is more of reactive. So it's when, because the vaccines are expensive, they can't afford to have an ongoing immunization program. So they have to wait until about the season and you start to see cases, they try to start to give people the vaccine. And of course, if you want to travel to some parts of the world, if you're coming um, from Nigeria and some other countries, they will like you to have a yellow fever vaccine. They like you to have taken a yellow fever vaccine. That's also an important vaccine to keep in mind. Of course, for a pregnant woman, the tetanus toxoid, right? The TT, very, very important. Tetanus, we hope, will be a thing of the past someday, but it's important that people take that. Hepatitis B vaccine, right? The hepatitis B vaccine is also an important vaccine that I think is important and people should have. And then, of course, our children, our kids should keep the MMR vaccine does not cause autism. Vaccines do not cause autism. So please, let's get vaccinated. Stay up to date with all your vaccines, and I think we'll all be the better for it. Vaccines save lives, right? Great. Next question, please. Next question. If you are just joining us, thank you for joining. This is Living Health TV Live, and the today is an Ask Me Anything, right? An AMA, so you can ask anything, and we will hope to answer to the best of our ability. How can I prevent or manage sleep disorders like insomnia? Um, Okay, sleep is vital. I think that's the first thing I like to say. Sleep is vital for health and well-being. I know the funny thing is that the questions usually revolve around people, the common things. Because you spoke about this yesterday somewhere where I was invited to speak. Because sleep is vital for human existence. If you don't sleep well, you pay somehow. And for some days, I've been sleep deprived. So I just knew I needed to catch up. I need to catch up um, with a sleep deficit because sleep is important. Sleep is critical for you to um, function well. So you need a normal adult needs 6 to 8 hours of sleep every day. Some people may still function effectively with a little bit less, but sleep is really important. So how do you prevent or manage? So one of the things is we are creatures of habit. So it's important for you to maintain a healthy uh, uh, routine, right? We work with routines. So if you can train yourself to know this is the time I sleep and this is the time I wake up, preferably at night, because you have a clock, you have an internal body clock, a circadian rhythm that also works with the sun. That's why you feel jet lagged if you move to another time zone. It takes a while for your body clock to reset, right, to what is happening around you. So preferably, we like you to have that 6 to 8 hours of sleep unbroken, non-stop at night. So anything that interferes with that, late night meals, medicines, um, drugs, coffee, right? They they may be disruptive to that sleep habit, making your room to be a temple of sleep, right? Temple in quote. So don't walk, don't do laptop as much on your bed, especially if you are struggling with sleeping. Make the atmosphere a conducive place to sleep. Don't do perpetual scrolling, right? Just scrolling on your phone using any of these um, popular apps, TikTok, IG, YouTube Shorts, uh, what else, Facebook, social media, all of this social media, even your WhatsApp, just scrolling and watching. It will. So if you are lying down, you see that you're not sleeping. Don't lie down there and just struggling. No. Get up, go do something else because it comes in waves, right? That wave. Go do something else, and then get back to the bed when you start to feel drowsy. Somebody said that the sleep of the laborer is sweet. So physical activity may be helpful. Staying active all day long. If you are really fagged out, trust me, you will sleep, right? And if you are still struggling, you are finding it difficult to sleep, then please, by all means, go see your physician, right? Go see your doctor. There may be medical reasons why you may be finding it difficult to sleep. Let's sort it out and get you the sleep that you require and deserve, right? Great. So go see your doctor. Next question, please. Next question. What are some of the most effective ways to quit smoking? Well, great. First, congratulations that you are trying to quit smoking. Smoking is dangerous. Smoking is deadly. Smoking is harmful, right? So everyone that is seeking to quit smoking is taking a good step. And those of you that are not quitting, that are not seeking, you smoke cigarette, you use tobacco, and you are not thinking of quitting, you need to get to that stage. You need to get to that stage where you are considering, and not just smoking. You're using other tobacco delivery mechanisms, right? The shishas of this world, the vapes of this world. You need to consider. Yes, those. So you may think that that's more dope, that's more cool, or that's less harmful, but you still have a whole lot of risk that you should not be exposing yourself to. So that person that is thinking of quitting, great, good that you are considering that. So you may need professional help to help you to quit it because it's an addiction, and addictions don't break easily. But it starts with that decision to do it. Some people will say set a date, right? Set the date that you want to stop. Tell people around you. Let people know. Hold yourself accountable to folks that I'm going to stop smoking on so and so date, and then remove from around you all the paraphernalia that helps you to smoke, that reminds you of smoking. So the ashtrays, the lighters, right, and all the things that are there that provoke you to smoke. And then if you need to, don't go near where you're going to be easily offered a cigarette. The pubs, the bar, the nightclubs, the smoking lounges. Don't go there because you'll just be tempting yourself more and and more. For a lot of people, part of the reason why they smoke is to cope. It's one of they're like they're essentially self-medicating. They're trying to use cigarette, tobacco, and the nicotine, the drug in tobacco, to ease pressure and make themselves feel good and feel high. So it may be useful for you to treat and confront those underlying reasons why you're taking comfort in tobacco. It's the same thing for alcohol or any other vice out there. So those underlying issues that tip you over to doing what you don't want to do, then please confront it. Whatever it is that you do, you're struggling with it, seek professional help, right? Talk to a counselor, talk to a coach, and walk through the process of breaking that negative habit. It doesn't matter for how long you smoked. If you stop, the day you stop, you start to reap benefits of stopping, right? So let's stop smoking. Hmm? Stop smoking. Great, fantastic. Next question, please. Remember, you can ask your question, you can join in, put your question in the comment section. I'll be happy. How can blood pressure levels? Fantastic. So that's important to do, particularly for people of color, right? Hypertension is more common in people of color than other people, other tribes, or the races. So it's important for you and I to strive to maintain healthy blood pressure levels. And the first thing, of course, would be to know your blood pressure level, right? So you need to know your numbers. And the normal blood pressure is for you to be 120 over 80 millimeters of mercury. Anything more than that, we start to get worried. And of course, if you now get to 140, 90 and above will start to look at you as hypertensive, and we don't want that. So they still asked me yesterday. It's a funny question. That is it what of low blood pressure? You people are always talking about high blood pressure. You never talk about low blood pressure. The reason why that is the case is that low blood pressure is not a problem for many people, right? Low blood pressure is not something we worried about. If you have low blood pressure, you either need to have lost blood, which is the most common cause, or you have some endocrine disorders, which are not as much of a pressing problem as hypertension is. And if you have low blood pressure, you will be symptomatic. You will know, you will faint. Something is going to. But high blood pressure often before, and for 90%, 95% of cases, we don't know what is causing it. You can't say this is what is making this person have high blood pressure. And then you often will not know anything is wrong until the person just suddenly probably has a complication, right? And by that time, it's too late. There's not much you can do. So the things to do to maintain healthy blood pressure levels: know your blood pressure, get to know it, know that level, right? And then of course the basic things that we do, the things that work for the blood pressure levels, work for the vast majority of all other chronic diseases that are killing the vast majority of people out there: heart disease, cancers, and metabolic disorders, diabetes, and the likes. So it works, right? So your diet, right? Watch what you eat, right? And this is closely linked to weight management. There's an epidemic of obesity globally, and now the thinking is changing from viewing obesity as just something that is a personal challenge. People will now starting to say, okay, let's view obesity as a disease that requires active management, right? So work on your diet, your fitness level, your exercise level, reduce salt. Salt, a high salt diet is strongly associated um, with hypertension. So reduce your salt. Your salt intake should be down. If you can survive without salt, go for it. But I know that's not feasible for most people. But reduce that salt content, especially if you have been diagnosed as hypertensive, or you have a family history or a predisposition to hypertension. So your diet, right? Alcohol. If we know now that even moderate amounts of alcohol may be risky, may be damaging, right? So we'd like you to cut down strongly on that. Of course, no smoking. Cigarette smoking is no, right? Keep an eye on your blood pressure. And if you're hypertensive, by all means, please use your medicines. I don't stop your medicines. Don't say when I feel somehow, then I will use it. Whether you feel somehow, you don't feel somehow, just use your medicine and closely monitor your blood pressure so that you can get it controlled, right? Let's maintain healthy blood pressure levels. Fantastic. Next question, please. Next question. Let's keep it snappy. We have just a few more minutes. Is it normal to have a boil on your private part that heals on its own? Well, I need to know whether it's male or female. You should not have boil. It's not a boil. A boil just simply indicates that there's a localized infection happening somewhere, and then a boil, particularly a private part, will suggest that what's happening there, something is happening there that should not be happening. So it's important to know whether this is a female, the location of the boil, a male having a painless boil or wound on the tip of the penis may be an indication for syphilis. It's painless. It's just with that. Um, and then it may heal, and then after it heals, doesn't mean that the syphilis has gone. You still um, have that condition. It could be a host of things. A female, it could be anything. It may not even be an infection. It may not be an STI. It may just be a cyst, a battling cyst, or it could be anything. So having a boil on your external genitalia, right? Your private partner. So I need to know, what are you talking about? Are you talking about your groin? Are you talking about so what part? What's the location of the boil? Is this a recurrent thing? Is it a one-off thing? Those are factors. So see your doctor, right? Meet your doctor, discuss with your doctor. Uh, let's know what exactly is causing this boil. It could even just be an equinox boil, that maybe the person has diabetes, pre-diabetes, because one of the things that happens in diabetes is that people tend to start to have recurrent boils. But this now to not be restricted to the private part, of course. It will be boils in different groins, armpits, different parts of the body, and length, the extremities. And just there's no predilection for the private part. So it's for us to know what exactly is the nature of the boil, the frequency of the boil, and then your doctor will be able to advise you best on what to do to heal and cure that condition if it needs to be cured, right? Great. Next question, please. So we'll take two more questions and then we'll call it a wrap for today. How do I manage or prevent sleep apnea? Okay, so sleep apnea is what occurs. Um, okay, in fact, we did a video recently about this on Area Doctor. Um, I don't know if it is up on YouTube yet, but if it's not up on YouTube, it's available on TikTok and it's available on Instagram at Dr. Adebayo is where you want to go. And I think if it's not available yet on YouTube, it should be up soon. You can just keep an eye, but let's hunt for it and put the link in the chat. Yeah, so sleep apnea occurs when somebody snoring heavily in the just stops breathing, right? Stops breathing periodically, and then they pick up. It can last for seconds and it can last for prolonged a period of time, and then they just start breathing again. And there are different reasons why that can happen, but the common one that relates to what we're talking about is the obstructive one. So where the tongue falls back or the airway falls back, closing it on itself, and the person is not able to breathe. And this condition can be deadly. It can cause a whole lot of the heart, metabolic syndromes, diabetes, and the likes. So the prevention of so that's is there is very dangerous. The prevention of sleep apnea is to first look at the things that predisposes someone to it, and then to prevent those things. So weight weight management is an important part of, because often it's associated with people that are the extreme obese. Bigger you get, the more likely you are. So if you are waking up, you wake up, you feel tired. It may be that you are having sleep apnea. Your partner complains that they are unable to sleep, or suddenly they just find out that you stop breathing in the middle of the night, and then you do all that. So you need to get it sorted. So what's the management for sleep apnea? The management is to look at those things that are causing it, and then to try to. So weight gain is important. I say weight management. I say weight gain. Weight management is important in sorting that. And of course, we can also use. There's a device. There are devices that can put pressure, positive pressure, on the airway and keep it open. So it doesn't matter how you sleep. And where if things are so bad that it's not getting them, surgery may be considered. Anything that can open up the airway and keep it open, um, it would be something to consider and to take a look at. Right? Great. Let's have one final question and then we call it a day today. Final question. Or if there's none, it's fine. We can call it a day. Oh, how can I improve my cholesterol levels? I think this is closely related to the same thing that I said that will help you with your blood pressure, will certainly help you with your cholesterol, right? So cholesterol, bad cholesterol levels is linked to a bad diet, right? Not eating healthy, eating a lot of trans fat, right? A lot of funny stuff, all those junk food. They can build up and help your body to have the bad cholesterol, which is low, the LDL, the low density lipoproteins. We want to reduce all that. So your diet, exercise, um, staying fit, right? Those things are helpful to help you keep your cholesterol level manageable. So eating nuts, legumes are useful. Is useful to helping improve on that. Right. So thank you so much, everyone that has joined today. I hope you've enjoyed the breadth, if not the depth. We try to go deep, but the breadth of the issues that I've covered today. Share this with a friend. It just save a life. Until next time, as we say for area level now, life, get duplicate. God bless you.